Hey guys, this video is going to be about non-operative treatment for an ACL injury. This is going to be part one of two of a series for exercises to help with recovery. The ACL stands for the anterior cruciate ligament. This is the ligament that's in the knee that provides stability to the joint. Usually when this is injured, likely in a sports injury or sometimes trauma, usually people present with pain, swelling, a sense of buckling, or a sense of instability that's within the knee. Depending on the severity of the tear, sometimes the injury can be rehabbed or treated conservatively, meaning without surgery. But sometimes depending on the tear and how big it is, if it is big enough, then usually an ACL reconstruction is needed to help repair the ACL. Just to be clear, so we're all on the same page, this video is primarily directed for the approach of non-surgical and conservative, meaning if you had surgery and you had the ACL reconstruction done, please follow the protocol of your orthopedic surgeon and your physical therapist, because this video will not be for you and there's going to be exercises that you're not supposed to be doing depending on your timeline. The exercises I have in this video are broken down into different parts. The first parts of the exercises are going to be focused on restoring extension of the knee, so try to get it back into how straight it is. The second part is going to be focused on flexion of the knee to try to get the bending of the knee back. And then the next part will be on lower extremity strengthening with a focus on the quadricep muscle. The following exercises are going to be focused on restoring extension of the knee. The first exercise to help with extension is the traditional quad set. This is an exercise that you can almost overprescribe in the beginning, mainly because needs to be heavily emphasis on restoring the quad, because a quad is a knee extensor, which then if you engage it, it will push the knee into extension. So initially after an ACL injury, one of the first things people lack is extension. So if they're resting, a lot of times is that their knee rests like this. There's a little bit of flexion. It's not all the way straight. Not only does the knee need to be all the way straight, there needs to be a little bit of hyperextension. You see how it bends kind of backwards a little bit? There's usually about up to about 4 to 5 degrees of hyperextension there to be able to get what's called the screw home mechanism of the knee, which then truly gets you 100% engaged on your quad. So for the quad set, all you really do is prop up your ankle with something. Here I have a little foam piece to prop it up. You can use a towel, a shirt, whatever, or a pillow. Essentially all you're doing is squeezing your quad and pushing the knee down into extension, holding that for about 5 to 10 seconds, and then repeating that about 20 to 30 times each set. So each one, you really want to get a quality quad contraction. You can put your hand here just to feel what that quad feels like. It should tighten up when you are engaging it. Another option to help restore knee extension is a simple knee extension prop. The position is the same as the quad set. The only difference is you need an external resistance. So you need a weight. Over here I have a 10-pound weight. You put the 10-pound weight on top of the knee, not directly over the knee joint, because at that point you'll be putting pressure on the kneecap. You want right on top of it, and then you just chill. So the concept of a low load, long duration is what we're shooting for here. So you want like a weight here, and you're just letting this push down. And in terms of what we're pushing for is you want to shoot for 15 minutes a day, and you want to do that up to a total of an hour. So about 4 times a day when you're doing this to try to help restore extension. When you're doing this, you could start with like 5 minutes at a time and then build yourself up into it. This exercise would be in conjunction of the quad set, so you can be doing this and doing the quad set at the same time by pushing the quad down and using the weight to push down to further help facilitate extension. A standing hamstring stretch with a quad set is another way to help improve your extension of the knee. So this is a nice exercise to do. It's very easy and straightforward. All you need is a strap like this that has a loop around where it goes around your foot. So you put it around your foot and you kind of step forward here. And what you're essentially doing is you let the other leg go back a little bit. You point it, you pull this strap, so it's pointing you're pulling your ankle towards you, in which allows you to get a calf stretch. You should get a nice stretch here when you're doing that. Hold that, and then instead of bending your back forward, you're hinging at the hip, pushing your butt back, keeping your back straight. So then when you do that, you should feel a pretty intense hamstring stretch there. When you feel the hamstring stretch, it should be in your back right here. You pulling up this way would allow you to get a calf stretch simultaneously. And then you can also engage the quad to pull the knee into extension. So you can hold this here for about 30 seconds or so, and then you repeat this for about 3 times. If it's too intense, you can probably go for 10 seconds and then repeat it for 10 times. Just do what you can at this point. It's a pretty intense stretch, but at the same time, what you're trying to do, the goal here is just to improve extension of the knee. Terminal knee extension is another exercise to help improve straightening of the knee. You need a band that's pretty strong. I have this tied up to my squat rack. But if you don't have a squat rack at home, then what you can do is tie a knot around the band and then just put it on the other side of a door and then close the door. So closing the door will help pinch the band in between. So then that way it will stabilize the band. And then all you got to do is just loop your leg inside the band, put it in behind the knee. And then what you need to do is step back where there's enough resistance. So much resistance that if you relax the knee, it's going to pull you forward. So that's how much resistance you want on this. So the exercise here is pretty straightforward. All you got to do is just push that knee back and then extend the knee. And then hold it there 10 seconds, repeat for 10, and then you relax. When you push the knee back, make sure you squeeze the quad to get you active knee extension here. This helps facilitate that knee extension range of motion. Hold it there, and then you relax. The only caveat here is you want to make sure the band is strong enough to, if you're relaxed, it pulls you forward all the way. The next set of exercises are going to be focused on restoring flexion of the knee. Heel slides is a nice way to help improve flexion of your knee. So I have a strap here. All you need to do is strap this around your foot to help with assisted heel slides. So you want to pull on this to get your heel to bend towards your butt. Hold it there for about 10 seconds and then let that go. Repeat this about 10 to 20 times throughout. Get as far as you can. It needs to be to the point where pain starts, just not through pain. So for example, if you're bending, and then it starts to hurt there, you can only push it a little bit, not much further than that. You don't want to irritate the knee, but you just want to tease it to get the range of motion back as much as you can. The next exercise is going to be an active heel slide. The motion is exactly the same, but we're actively engaging our hamstrings to try to get the knee to bend. Just as similar to a quad set, this is basically the quad set for flexion because you're using the hamstrings to help bend the knee. So what you're essentially doing here is bringing the knee towards you as far as you can go with a ball. If you don't have a ball, you can just slide your foot on the table, but use a towel. Make sure it's something that's slippery. Holding it for about 10 seconds, and again, repeat for 10 to 20 times. Relax here, and then you just come through, and then repeat, going again as far as you can, provided that you can tolerate your symptoms. The prone quad stretch is the next exercise to help facilitate flexion. So you use the same strap as the hamstring stretch that I showed earlier in the video, something similar where you can loop it around the foot. You're laying on your stomach here, and all you're doing using both hands, you're just pulling to try to get the knee to bend as far as you can go, provided that you can tolerate your symptoms. Once you get to the point where you feel that stretch, hold it there for about 30 seconds if you can, and then you repeat for 3 times. When you get to a point where you improve your knee flexion to a good amount, meaning you at least get it past 90 degrees, then at that point, it would be a good idea to add some load to the flexion to help restore it even faster. So what you do is you do an assisted squat, you hold on to something stable, and then you just slowly go down into it, provided that your hands can assist, and the lower that you go, the more of a stretch that you get and the more knee flexion that you get out of it. If you get to a point where your calf is in the way and you can't go down all the way into a squat because it looks like that, then what you can do is you can put something underneath the heels to elevate it. You can use like a plate, or you can use a small step to kind of elevate that to allow the knee to bend a little bit more. And once you get down here, you would hold it for about 10 seconds and then you repeat for 3 to 4 times. If you can hang out down here even longer, that's better. That's when I usually shoot for 30 to 45 seconds. One of the last ways I like to improve flexion once people have restored the majority of their range of motion and they're just trying to get that last 10 to 15 degrees, I like to have them tall kneel and sit back into it. So what they can do is get a foam like this. So then that way you can lean forward so your ankles are hanging off a little bit. And then all you do is just sit back into your knee to get the maximal amount of flexion that you can. If you do this without the foam and you have tight ankles, you can't push down anymore, then what happens is if you push down this way and you don't have the range of motion here, you're not going to get as much flexion as possible. That are mainly because this is going to be very uncomfortable. Another thing you can do is you can do this at the edge of your bed, just kind of at the edge. So this is, your shin is on the bed and your ankles are hanging off at the edge. So that way you free the ankles from this exercise and you can just purely focus on flexion of your knee. When you're doing this, you can hold this for 30 to 45 seconds, repeat 3 to 4 times, provided you can tolerate your symptoms. At the end of these exercises, if your knee becomes a little bit more swollen, if there is increased pain, please use ice to help alleviate some of those symptoms. Usually I have my folks do this for about 10 to 20 minutes per time of ice, and I have them do this about 3 to 4 times a day, depending on how much swelling there is, how much pain there is, what they can tolerate. That's it for the mobility exercises to help restore extension and flexion of the knee. Stay tuned for part 2, where we focus on exercises to help restore the quad and lower extremity strengthening. Thanks for watching. I'll see you next time.